All right, so let's go over the posterior cervical counterstrain points. Looking at the maverick points in this table, it's going to be PC1 inion, and then it's going to be the PC3 midline spinous process here. Now these are maverick points because they are flexed, and then for PC1 inion, it's also side bend towards. This is also side bend away, rotate away like the others, but really it's the flexion that makes these unique. For all of the other posterior cervical points, it's extension, side bend away, rotate away, E-Sara, all of that. So really just keep these two in mind, like literally write in your book and just mark those as, you know, the maverick points. Now if we look here, PC1 inion is going to be right here. So that's a maverick point, okay? This one, that's really midline. And then the PC3 midline right here, these are the two maverick points on the body. Now if we go up to him, and I will point these out. So PC1 inion, that nuchal ridge, and then it's gonna be like right there. So here's the direct midline. We're coming just off of the midline here. And that's where you're gonna find that maverick point, okay? And so if you have PC1 lateral, it's just lateral to that. That's gonna be the other PC1. But remember, this is the main maverick point. So PC1 inion, and then PC1, that is lateral. And then you have PC2, so it's gonna form like this triangle here. PC2 is gonna be right here, okay? So you have inion, PC1, PC2, and then the PC3 midline, that's a maverick, is right here. Sorry, I'm drawing on your neck. It's right here. So maverick point, PC2, PC1, okay? And so as we go down, PC2, PC3, maverick point, and then you go 4, 5, 6, 7, and then his T1 is here, okay? So those are the midline. Now as you come out lateral, those are gonna be on the articular pillars. So those lateral articular pillars are here. So I'm gonna actually grab a mark. Can I draw on your neck? Here. So here are the spinous processes here. So remember, for all of these midline points, that is going to be the lateral tip of the spinous process. So people are like, well, if it's midline, how is there a lateralized part? Well, it's because there's bifid processes. So you have, you know, inion is going to be here, and then PC1, PC2, and then PC3, maverick, and then you have 4, 5, 6, 7, okay? And then here's like the spinous processes, right? Here, midline points. And then if you go to the articular pillars, right? So you're gonna have PC3, 4, 5, 6, 7. Those are gonna be here. So 3, 4, 5, 6, 7. All right? So you guys can see those are the lateral ones. Remember, everything else is E-Sara, extend, side bend, and rotate away, except for the maverick, 3, 4, 5, 6, 7. This, and the inion point, which is gonna be under his hairline here. All right, and then PC1, PC2. So those are our points. Now let's show you guys how to treat with that. All right, if you wanna lie on your back, head up here. So let's actually find where he has tenderness and go through it. I'll start at the top and work my way down. This is your inion, so let's try right side versus left side. I know which one I think he has tenderness, but what do you think? This one,
right?
Yep. The right is definitely more hypertonic. So for the sake of this treatment, we're gonna call this a 10 out of 10, okay? Mm-hmm. And so remember guys, so this is gonna be flex, little side bending towards, and then rotate away, okay? And so what would you call that now? 3, okay. Let's see if we can get it a little bit better. Maybe a little more flexion. How about now? Like a 2. I'm gonna compress it slightly and fine tune. How about now? 0. Okay, so then this is where you hold for 90 seconds. You can maybe check every 30 or so just to make sure you're in the right spot. And then again, as we release it, take a deep breath. He exhales, I bring it back to center, and then we recheck for counterstrain. So that would be our first maverick point. Now let's do a typical posterior cervical point. Let's find like a PC, see if he's got anything left or right. Left, yeah, for sure. You wanna come to this side? So he's got like this PC4 lateral on the left. So finger is right here. That's where he's got a lot of hypertonicity. All right, patient, we're gonna call this a 10 out of 10 for the sake of that technique. So remember, this one is extension. So I'm gonna have you slide a little bit back towards me, and I'm gonna just keep supporting his head here with my hands. Good, and we're gonna extend him around that level, and then that is just away. And then as I feel that tissue soften, a little bit of extension. How would you rate that?
That's a good.
3? Okay, let's try a little more extension away. How is it there? 0. Okay. And then again, hold for 90 seconds. Don't move your finger. And then you just wait and feel the tissue soften. And then you return back to neutral after that 90 and recheck. And it's a 0, right?
Yes.
Yeah. All right, so that's how you would do posterior cervical counterstrain.